Hi, Diana. So we have a patient, room 200, Angel Lee, and she came in with the medical diagnosis, diabetic ketoacidosis. Their chief complaints are nausea, vomiting, extreme thirst, and confusion. So first of all, I need you to get the vital signs. And very important, we need the blood pressure because since she's having extreme thirst and with nausea and vomiting and everything, she might be hypovolemic. So we want to make sure that's checked first because we don't know where it's at, you know. So, and once you get that, as well as the other vital signs, can you report that to the LVN IG?
Yes.
Okay, thank you. Hi, Nancy.
Hi,
so we have a patient at room 200, diabetic ketoacidosis, her diagnosis. Chief complaints are nausea, vomiting, extreme thirst, and confusion. I already sent the CNA, Diana, and she is checking the vital signs right now. So if you can get those from her once she's ready, she should be done. She should be almost done. And also, once you get that, can you also go to the lab? They should be ready by now. I asked for a blood sugar level as well as a urinalysis, and also if you can check the pH as well. I'm pretty sure they got that ready too. She's also complaining of nausea and vomiting, and so if you can give her a Zofran, just make sure you document that PO, and that way at least we can take care of that as of now before we find out what else she has and what we can do from there, and we can assess the patient and see what we can do, right? So if you can do that and get in contact with Diana and just bring back to me the results.
Sure.
Okay?
Thank you.
Thank you.
Hi. Angel? Yes. My name is Diana. I'm the CNA. I'm just going to go ahead and take her vital signs, okay? Vital signs, okay. Are you comfortable? Can I get you anything?
Can you get me a blanket?
Yeah, no problem. Do you need help, assistance going to the bathroom or anything?
I'm good for now.
You good for now? Just a jacket for you. Is there anything else I could do for you? Send you a drink?
No, I'm good.
You're
Thank
okay?
you.
Hi, Diana.
Hi, Mechi.
I was able
Yes,
to take her
can I get
vital
the data?
signs. Yeah, her blood pressure was 85/53. Her heart rate was 101. Her temperature was 99.2. Okay.
Okay, got it.
Thank you.
Hi, Angel. Is it Angel Lee?
Yes.
Hi, I'm Naishi. I'm your LVN. So, do you feel any pain right now?
I'm just a little bit nauseous and yeah.
Nauseous? Okay, so the doctor ordered you a Zofran, so I'm gonna give it to you right now. So if you do feel any like nausea too, just let me know, okay?
Okay.
Thank you. Hi, Louis.
Hi, Nancy.
Hi, I already collect the laboratory data from Angel Lee's.
Angel Lee, okay.
Angel Lee's data is blood sugar level is like 500 ng, and urine analysis is positive with the keto label, and then the
okay.
BP is 85/53, and the arterial pH is 7.1, and she still feel nausea, and then I already give her a Zofran already.
Okay, great. So we'll reassess in about half an hour to an hour. See where she's at with that.
Okay.
Okay, and due to that, okay, I'm gonna go. I'm gonna assess the patient now and make sure that everything's good. But with those diagnostics, I guess the nursing diagnosis is deficient fluid volume. Related to hyperosmolar urinary losses and gastric losses, evidenced by increased urine output, extreme thirst. You also reported poor skin turgor and also hypotension because and that's one thing we got to really look at because with patients with ketoacidosis, once they have that hypotension, they can really go downhill really quick if we don't take care of that. So I'll report that to the doctor, and we gotta get those fluids back up and everything. Also, unstable blood glucose levels 500 is really high. It's related to the medication management and lack of diabetes management. So I will have to teach the patient that, as evidenced by the presence of ketones in the urine, nausea, and vomiting. And like we gave them the Zofran, so hopefully that's fixed soon. So I will give an IV insulin as well as an IV sodium chloride, so we can try to get those the volume back up and also the blood glucose back in normal stable conditions. So that's it. So I'll get that done with, and I'll go report to the doctor everything that we got. And thank you.
No problem. Thank you.
Hi, Anjali.
Hi.
It's you and Julie, right? Okay, I'm Luis Rubalcaba. I'm the RN assigned to you for today, and so I'll be taking care of you. You've probably already met the CNA and the LPN, so they've been working with me, getting your information and all the diagnostics and everything. So now I will just tell you what's going on and what we can go from there. So we're trying to help with your fluid volume. You're deficient right now, so we want to increase the volume in your body. So what we're going to do is I'm going to give you an IV with sodium chloride, okay? And then also we got to get your blood sugar back to normal. It's very, very, very high, and that's probably the reason why you're feeling a little nauseous and feel like vomiting and all that. And so I'm going to give you an IV insulin as well, okay? In order to get that back and running. How's your pain right now?
It's like a 7 out of 10, I think.
Oh, okay. So then we're checking everything. I will let the doctor know about the pain, so that way we can see what we can give you that doesn't go against your condition, and make sure that everything's good. Okay, so we'll take care of that, and then I'll reassess the pain after in about half an hour to an hour once I give you that. So then I give you the IV, and then the insulin IV and the sodium chloride IV. And also I'm going to let you know that we need to make sure that you're aware that you have diabetes, and right now at the moment you have the medical diagnosis of diabetic ketoacidosis, which is ketones in your blood. And so we need to always keep track of what you eat, of your sugar. That's very important, because what happened with diabetic ketoacidosis happened because you either were let the sugar get very, very high, and once you get that sugar very high, it builds up certain fatty acids, and those fatty acids will actually eventually turn into ketones, and your ketones, usually the body uses them for energy and stuff, but there's an overuse, and it will stream into your blood, and that's the reason why you're feeling this way, because of the ketones in your blood. Okay. And other than that, hopefully everything works out, and I will keep checking you. I will send the LV and CNA. CNA will make sure that you're comfortable. If you need anything, any ambulating, feeding, bathing, anything like that, they will take care of it, and the LVN will be reporting to me. And if you need me as well, just let them know, or just bring your bed light, and we'll be here. Okay.
Okay, thank you.
Okay, you're welcome. Thank you.